So I was wondering, as president, what are you planning to do to make sure federally children are insured?
Thank you for sharing your personal story to bring everyone's attention to this issue. As I mentioned earlier, you should never have to worry about what it will take or what it will cost to be able to take your child to a therapist or afford a medication or make sure that they get their shots or just make sure that they're well enough to learn on the first day of second grade. I want them focused on listening to their teacher, doing well and meeting their new friends, and yet that's the reality for far too many of our fellow Americans, tens of millions who literally do not have insurance. Complicated in some states like Iowa where we privatized Medicaid. We made it harder, especially in rural communities, for rural clinics and hospitals to stay open. We just learned of another one discontinuing some levels of care here in Iowa this last week. The solution to this has to be universal, guaranteed, high-quality care. My path to get us there is to ensure that everyone who is not cared for now enrolls in Medicare. Everyone who is insufficiently cared for, who is trying to navigate that bureaucracy, who cannot afford their premiums or co-pays, can enroll in Medicare if they choose. And those who have employer-sponsored insurance that they like because it works for them, members of unions who fought for that health care plan, maybe in lieu of a wage increase, they can keep that. And so you get to universal while preserving choice. You roll Medicaid into Medicare. You roll the Children's Health Insurance Program into Medicare, a program that is incredibly effective at a very low cost overhead to the American people, where we just focus on making sure that your kid is well enough to live to their full potential. That's my plan. Thank you for asking. Appreciate it.